Let's talk about the face. Overall, the skin is covering the face. It is very thickness. It may be thick like that on forehead. It will be very thin like those on the top of the lips, on the eyelids. It has a number of sweat and sebaceous glands that leads to sweating and the oily nature of the face when there is hot temperatures. The thing that separates the skin of face from rest of the body is that it does not have any deep fascia. There are a lot of muscles that are getting inserted to the inside of the face that gives rise to the make possible the facial expressions, and that also makes possible the wrinkles. So usually the wrinkles that are created in the face are about 90-degree to the muscle direction. For example, front occipitalis, the frontal valley comes like this from up downwards. When it contracts, you get these frowning wrinkles. And here are the orbicularis oris muscle. As you grow old, there are crow foot wrinkles, and so on. So these are due to the muscles, and that's why the Botox injections works. You actually paralyze those muscles. Those who are creating the wrinkles, they get paralyzed. Apart from that, the things that you may notice on the face is basically the hairline. The hairline. This hairline, not a definite anatomical landmark. It may have a variable location in a different individual, and that defines the upper extent of the skin. Lower extent, it is defined by this jawline. Then we have forehead. Forehead is included in both the face and the scalp. The forehead region up to the eyebrows, it is included in the scalp region, and up to the region of hairline, or where the hairline should be, is also included in the face region. We have eyebrows, nose, nostrils, eye, medial angle, lateral angle, also known as canthi, this vertical lip. Excuse me. So this vertical groove that is in middle of the upper lip, that is the philtrum. The lips, the part that is reddish, the very thin part of the lip on which you put on the lipsticks, that is the vermilion border, and that's about it. We will go into the detail of the things as we move along. Okay, let's